Welcome back to an Ask Lee edition. I am Matt Oliphant, the Customer Happy Specialist, and today we got the amazing and brilliant mind of Lee. Lee, what's up, man?
Hi, Matt. Hi, everyone. I'm great, thanks. I've just got back from a 3-week US trip where I was the Chief Medical Herbalist attending a bunch of veterinary conferences. And I did a seminar in Berkeley to a group of healthcare professionals, which was a whole lot of fun. So, yeah, it's good to be back home.
Yep, nice. Very nice. Yeah, it's good to have you back, man. It's awesome. Did you do any foraging at all when you were out there?
I did, actually, and I got to do the mother of all forages. I got the chance to forage with Adam and Sky Chilton. So right out the back of the old family home, which is now kind of like the headquarters of Namex. There's a massive, big lobster mushroom patch, and we harvested pounds and pounds of these things, and we were dreaming up all different ways to cook them. And then by the time we got there, Sky came along and was like threw half of them away because they didn't meet his high standards. But we also went foraging for chanterelles together. So Adam and Sky and Mika, the marketing manager, and myself. So what a wonderful experience to see the mushrooms like up close in the woods. It was fantastic.
Oh man, yeah, there's nothing better. That's awesome. Alrighty, so today's topic is about Pink October and women's health, which is a really awesome topic. And yeah, so Lee, what are your kind of initial thoughts on Pink October and women's health in general?
Well, I have got a lot of thoughts, and I'm really keen to share them. But before I do, I just should say that I'm not a medical doctor. Matt and I aren't offering any medical advice. If you have any specific issues, strongly recommend that you contact your healthcare provider to get, direct support, for your concerns. So a little bit of housekeeping out of the way. So,
for sure.
Yeah, mushrooms have got a huge amount to offer women, Matt, and there's as women go through the different stages in their life, mushrooms play different roles, and clearly herbal medicine has got the full toolkit for supporting everything to do with women's health. And mushrooms, being limited in number and being a little bit perhaps limited in the extensive range of the chemistry that they produce that influences the health of the body, there's a narrower segment of support that mushrooms can provide, but it plays a very, very important role, and I think it's one that's often overlooked in the modern world. And the introduction of mushrooms, I think, can play a really important role, for all women.
Yeah. Nice. Awesome. Alrighty. Guess we'll get moving here. Here's the first question of the day here. It is, what mushrooms are best supportive for women during menopause?
Well, what a great question to start off with. And there's a big answer to that question. So perhaps I'll just kind of touch the highlights, and then, maybe we could come back to, to various topics, because I could not draw breath and talk on that one for at least half an hour. When women are experiencing menopause, it's clearly a natural stage in their life where the body's no longer producing the same levels of estrogen, and the body's adjusting to what's going to be like the next phase in that woman's life. So there's a number of challenges that are associated with the body's adjustment and adaptation to those changes. So the most commonly discussed things are the hot flashes and the irritability, and the poor sleep quality, and the way that the body expresses dryness. Estrogen being low means that certain tissues no longer produce the same amount of secretion. So they're commonly the most they're the most common types of complaints. And mushrooms can play a role in supporting some of that. So lion's mane, for example, can help with some of the issues around mood and poor concentration, for example. So that's a good mushroom, to consider in that area. Tremella is great in terms of general dryness. So in terms of dryness of skin and a reduction of secretion. So it might be dry cough, it might be a reduction in vaginal secretions and dryness in that area. Tremella plays a really important role in that category. The health of the bones changes as a result of the loss of production of estrogen. So there are changes that get expressed in bone mineral densities, and maitake and shiitake have a role to play in supporting that aspect, which is a little bit more specific. And then, like, generally speaking, when we eat foods, and we don't often kind of can think about it in this way, but foods have got lots of different chemicals in them, phytochemicals, and foods like flax seeds, soybeans, as tofu or tempeh, that's from an organic, non-GMO source, wild yams, or yams in general, sesame seeds. These foods have got phytoestrogens in them, and those phytoestrogens need to be modified by bowel flora so that they can be absorbed into the body and support the various levels of estrogen receptors. And there's two types of estrogen receptors. There's alpha and beta receptors, and the alpha receptors are the ones that promote growth, and the beta receptors are the ones that control, like, the majority of the complaints around menopause. So the phytoestrogens need to be produced in a certain quantity and interact with those beta receptors expressed throughout the body to help control those issues that women are experiencing. And for that to occur, you've got to have the food source of those things. And there's a bunch of herbal medicines which deliver those compounds as well. But the missing link and the place where mushrooms come in is in terms of modifying the bowel flora so that those food and plant-based phytoestrogenic molecules can get converted into their active constituents where they can deliver their effects in the body. And when experiments have been done, there's sometimes a 400-fold difference in the ability of the bowel flora of the female patient to convert those phytoestrogenic molecules into their active forms. So the role that mushrooms and all mushrooms play, and the reason to be consuming mushrooms on a very regular basis, is the significant prebiotic potential that they have to modify the bowel flora to create a healthy environment where those conversion steps can be made as effortlessly and efficiently and kind of maximally as possible. And that then plays a really big role in the manifestation of the typical menopausal symptoms. I could keep on going on, but maybe that's a good place to put a break there, and then we can come back to some of those things. We didn't talk about Reishi, for example, and cardiovascular function and tone.
Yeah, nice. Yeah, I'm going to think of something. You had mentioned phytoestrogens and certain seeds. Is there any research behind, like, seed cycling with, like, sesame, hemp, chia, flax for just kind of hormones for women, like, in general? Or what are your thoughts kind of on that, if you've heard about that is?
No, I don't think there's any need to cycle through, the seeds. Flax seeds has got the best and possibly the easiest access, best evidence, easiest access. And the dose is about 1 fluid ounce. If you had a measuring cup in the kitchen, a fluid ounce, so like two tablespoons would be like the right dose, and they need to be ground up. I do think, though, like, part of the the background to your question is that the body would do better on certain types of phytoestrogens than other ones, and that might be to do with bowel flora. But some of these molecules, the end products that get produced are all the same, even though they've got different food sources. So
Gotcha.
the benefit of cycling or blending seeds and fibrous foods is the complexity then supports the health of a more diverse microbiota. So if you only ate the one thing, then the bacteria that live in your gut, which we need to think of as another organ of our body, because the bacteria play these metabolic roles that tissues and glands and organs in our body can't perform. If we only give them one food, then they've only got one thing to eat, and it preferentially feeds the bacteria that like that particular food. So the more diverse the diet, and the more diverse the soluble fibers, the more diverse the bowel flora, and then the healthier it's going to be.
Right on. Awesome.
Yeah.
Alrighty, going to the next question here. Next question is, what mushroom do you think has the most clinical research behind it when it comes to supporting women's immune health?
Well, in the context of this environment, we need to be talking very generally about the immune system, and we can't get very specific just because of the way the legislation is written. So I think that turkey tail makes the most sense, for supporting women's immune system health. But any mushroom will do that. And if we looked at the immune system, and there's all of the glands and tissues. You got your spleen and your thymus. And you got bone marrow, which is a site, of white blood cell production. And then you got all of the white blood cells that circulate in the blood, and you got resident ones that live in your tissues. The cells of the immune system have got very highly specific roles to play, and a cell like a natural killer cell roams around in the body, and its job is to pick up cells that shouldn't be there, where things might have gone wrong, and it no longer has a place in the body, and it needs to be removed. So many of the mushrooms, but shiitake does it, reishi does it, turkey tail does it. I think they all have a role in this. Will improve the cell numbers, improve the health of the cell to make them more effective at what they do, to make them more accurate in the way that they go about their job, and to make the responses that the immune system has to be as strong as it needs to be. So not too strong, not too weak. So all aspects of the immune system get supported. So I would say that, from a very highly specific point of view, turkey tail is the one that, is in everybody's consciousness. And if that mushroom was taken daily throughout life, then it would have a preventative effect in terms of ensuring that the immune system was going to be as competent and accurate and doing its job as possible. But just like we were having that conversation about the different fibers, in the foods that we eat, I think that a more broad-based approach with mushrooms, so having 4 or 5 or 6, mushrooms on a regular basis means that every aspect of the immune system is going to be looked after, and not just, maybe one slice of it. So I think that, turkey tail, yes, number one, but in terms of products that people could purchase and consume, I think that the 5 defenders is a really well-balanced approach at supporting all of the different nuances that go on in the immune system that would, and prevention is, the best approach. And I think that, many of us kind of procrastinate a little bit about, looking after our health. and we're only acting on things when we get the news, oh, something's gone wrong. It's like, holy hell, like, how did that happen? Well,
Yeah.
if we did some mushrooms, every day throughout the course of our life, there'd be less challenges as we get older.
Right. Totally. Yep. It's kind of like the long game. It's more of a marathon, and
the long game. Yeah. And it's always a challenge, but I think that it really is the right way to go.
Oh, totally. Couldn't agree more. Alrighty, going to the next question here. How might ergothioneine impact reproductive health or hormone balance in women?
Oh, yeah, that's an excellent question. So ergothioneine is kind of like the new kid on the block, and it hasn't penetrated, the consciousness of the masses yet, as it has the capacity and potential to. So it's a new topic for many people. And ergothioneine, let me see if I can explain it simply enough so that like everybody can understand it, because it's quite a complex topic. But ergothioneine is an antioxidant, and its main role is protecting cells against the naturally occurring oxidative stresses and strains that occur within cells. And we need to understand the nuances of it to make sense of the reproductive and hormonal balance aspects to it. So when a cell naturally experiences stress, so just imagine a balloon full of water, and that represents a cell. So the balloon is the cell membrane, and the water inside is the watery environment inside the cell. So when there's stress inside there, which is naturally occurring, glutathione is the primary antioxidant that controls the levels of stress. And we can use acidity or pH as kind of like a surrogate marker of the stress. So when things are a little bit stressed, the pH of the water starts to become lower. So it goes down and it becomes more acidic. So just imagine vinegar. You're adding a little bit of vinegar into the water to make it more acidic. So as the glutathione deals with the stress, it gets consumed. So it goes down, and then as the glutathione goes down and the acidity increases, then that allows the ergothioneine to get engaged, and it becomes the antioxidant in that now acidic environment, and it's protecting the cell while the glutathione is being regenerated. So they kind of like a tag team. When glutathione's low, it tags the ergo to say, can you come in and help out while I'm low? So in that sense, and that kind of reaction is playing out in every cell of the body, and ergothioneine is expressed everywhere, but in some places it's expressed in higher levels. So one of the places where ergothioneine is very, very highly expressed is the fallopian tubes, for example. And no one's looked at the relevance of that in terms of health. But what it tells us is that if you're low in ergothioneine, your fallopian tubes aren't going to work as well. And they're the tubes that allow the eggs, that are being produced from the ovary, to come down. So if there's issues there, then that process, might not work as well, and then the delivery of that ovum and its ability to implant might be impacted, for example. So every cell in the body and every tissue stays optimally healthy because of that balance, and it's a very much the fine tuning around these cells. So if you're deficient in ergothioneine, it doesn't show up quickly. It shows up over the course of your life. So you're more likely to have challenges in old age. But There are some clinical trials around pregnancy and mushroom consumption. And when women consume 100 grams of white button mushrooms a day during their pregnancy, so that's 3 ounces, the pregnancy is healthier. There's less gestational diabetes. There's less preeclampsia. Babies are more likely to be normal weight as a result of that. So scientists think that ergothioneine plays a role in the health and the stress that's going on in the placenta, for example. And there's some good evidence to support that. And the other thing that ergothioneine does is it makes mitochondria work better, and it protects the mitochondria against stress as well. So it's antioxidant, but it also boosts energy levels and makes mitochondria work better. And in animals and humans, so every mammal has got a need for ergothioneine. It's almost a vitamin. It's definitely like a conditionally essential micronutrient. And in women that are breastfeeding, there's a 4 times increase in the transporter proteins for ergothioneine. So transporter proteins are like doorways that allow the ergothioneine to come in. So we've got them in our gastrointestinal tract, and any ergothioneine we consume from a mushroom gets taken up into our bloodstream. And then those transporters or doorways exist in all of the cells of our body where it gets taken up. But the doors only work in one direction. So once the ergothioneine comes in, it doesn't come back out again. Except in lactating breast tissue, the epithelium, the transporters are turned around, so the doors open out. So in breast milk, there's very high levels of ergothioneine that are being delivered to the young infant. So ergothioneine plays a really important but currently unrecognized role in neurological development. And in mice, it plays a role in neurogenesis. So at that end of the equation, like it's really quite profound. So I think that it supports reproductive health, for a number of different ways. In terms of hormonal balance, not a lot is understood about that. But, anywhere where there's stress and strain, ergothioneine is likely to be, a benefit. So it's a regular part of my, recommendations in clinic now. And Real Mushrooms has got the Ergo Plus, which has got 10 milligrams per capsule now. So just one of those capsules 5 times a week would be enough for general health. So a bottle of 60 capsules would last 12 weeks, which makes it like really affordable, support for the patient.
That's awesome.
Yeah,
I got
fascinating area.
Yeah, it's amazing. So when someone takes ergo, how long does it typically last, you'd say, give or take, in the body? Does it kind of go through, or does it kind of retain for a while?
Good question.
Obviously there's other gut health stuff, but
because it almost meets the definition of a vitamin, and it doesn't quite, because it isn't lethal in the sense that if you don't get vitamin C, you get scurvy and die. With ergo, if you don't get it, the challenges that develop happen, over the course of your life. So it dilutes your health span, and it shortens your life, by maybe 5 or 6 years, according to the epidemiology. Golly, I just lost my train of thought then. So it's a water-soluble vitamin, and most of those water-soluble vitamins exit the body really quickly. So if you take vitamin C or vitamin B, you can go to the toilet and 20 minutes later, you've urinated out all of your vitamin B that you've just taken. But the body really avidly hangs on to ergothioneine, which is another example of just how evolutionarily important it is to the human body. So the half-life's about 30 days. So if you took 10 grams today, and then you could measure that 10 grams. If you could kind of label each molecule in there, and you go back and have a look a month later, there'd be 5 grams still in the body. And then a month later, there'd be 2.5, and then in another month there'd be 1.25. So it only very slowly exits the body, and it's a very safe molecule. Scientists that were doing the lethality experiments with rats gave up, like they couldn't make rats, like unhealthy by giving them too much ergothioneine. So the safe levels in humans are pitched at about 9,000 milligrams a day, which is like 900 ergo plus capsules. So, there's no way that you can kind of overdo it. And we don't currently know what the right dose is, because those experiments haven't been done. But when you look at populations that consume large amounts of mushrooms and compare their health around the world, scientists come up with this number of about a minimum of 5 grams a day would be kind of like the low end of that mark. So between 5 and 10 a day makes a lot of sense. Probably you don't need more unless you're dealing with very highly specific things. And it may be an intervention that you could take to improve physical performance, for example, or if there's a health challenge that you're dealing with, maybe high levels could help very specifically deal with a particular thing.
Nice. And regarding like reproductive health, is there any research on that, like in ovary health in women with ergo intake, or is that too kind of probably not enough research in that area? Or have you heard anything about that?
There isn't any research yet, but you could infer from the expression of the transporter proteins. When the expression is high, then there's clearly like an imperative, evolutionarily speaking, to have it there. And in all of the female reproductive structures and organs, there's a need for ergothioneine based on the presence of those transporters. And the transporters are what I would say they're constitutive, so that they're present all the time at naturally occurring levels that will vary depending on the tissue. So like in the eye, which gets a lot of oxygen and gets a lot of UV light, there's high levels of expression because ergo is a very important natural protective mechanism for the eye. It's very high in red blood cells, for example. So it's not as high in female reproductive structures, but it is present and it's constitutive. But it's also inducible. So if there's stress, then the way that the body deals with stress naturally increases the expression of those transporters. So the expression can go up and down depending on what's happening and how happy or how unhappy the particular tissues might be. But it's a really interesting area, and I think that for any woman that's experiencing some challenges reproductively, I think ergothioneine is a really safe place to start, and it can be self-prescribed. You don't need the advice of any healthcare professional, because it's very safe and our body needs it, and many of us, and when you look at the data of mushroom production that comes into the US, I think that people on average in the US are only eating about 3 pounds of mushrooms a year, which translates into like very suboptimal levels of ergothioneine. So we could all supplement with some ergothioneine quite safely, and particularly in that female health category.
Yeah, absolutely. Yeah, it's gonna be cool to see if like multivitamin supplements for women's health in the future start having ergo implemented into it. So it'll be kind of cool to see where that goes.
I'm absolutely confident it is, and it's already happening in the cosmetic industry. Ergothioneine transporters are expressed, very strongly in the skin, And when you apply ergothioneine topically, the skin takes it up. So it helps protect all of the cells in the skin against the stresses and strains that they experience. So, the biggest challenge for skin is dealing with, the sunlight. So that creates stress, and ergothioneine helps mitigate against that, as does the tremella. So tremella is fantastic in that skin category as well.
Totally. Awesome. Alrighty. Yeah, no comments right now, so we'll go back to another good question here. A little different, but still in line here. Aloe Defender's blend have been taking it daily. I read it as advised not to consume chaga every day. Do you have any advice on optimal intake for chaga, like daily with breaks of a few days, or?
Good question. Chaga is definitely a low dose mushroom, in my opinion. And in the 5 Defenders, it's the last entry on the label, and it is the lowest amount. So you could take 2 capsules of 5 Defenders every day and be under, slightly under what I would recommend as the lowest kind of daily dose. So I think, like 1 gram a day is like, the therapeutic low end. And I think 2 capsules of 5 Defenders is about 800 milligrams. So I wouldn't have any problem with people doing 5 Defenders every day long term. And most people take breaks naturally. It's very rare for someone to be so kind of routine that they would go every day of the year and do exactly the same thing. So I think, breaks naturally get built in just based on human nature. So we don't need to worry about that from a mushroom point of view, because it's the doing it over the course of your lifetime which makes the difference. So, you can have a month off and it's not a big deal. Like you can have a week off here and there and it's not a big deal. What is a big deal is that you recognize that you've, stopped that habit and you come back to it, so that it's a regular part. And I always like to joke that, exercise is very similar to how we need to think about our mushroom consumption. And you have to do exercise some every week, ideally every day. You can't just do it all in one month of the year and have the rest of the year off. Mushrooms play the same role. You've got to do, little bits on a very regular basis throughout the year to get the full benefit of it.
Awesome.
And
deal here.
Let me come back to that chaga comment just again. Chaga's got molecules in it called oxalates, and oxalates are the same things that are in spinach, for example. So if you have very high levels of chaga, for people that are sensitive to oxalates, they can cause kidney stones. And it's to do with bowel flora, because bowel flora digest those oxalates and prevent them from being absorbed. So some people don't have the bowel flora machinery to break the oxalates down. So it's not always a uniform kind of challenge for everybody consuming chaga. So some people may, be more sensitive or may have different bowel flora, and they might be more sensitive to chaga. So, there's a little bit of individuality that we need to play into it. And that's why chaga is at such a low dose in the 5 Defenders. So it is, quite safe to do long term.
Yeah. Interesting. Are there more oxalates in that versus like blueberries or spinach or like almonds, or how would those foods compare to chaga as far as just the concentration of oxalates?
Yeah, I can't quote numbers off the top of my head, but chaga's not high in terms of its oxalates. It's not. It's not. Something like spinach and rhubarb are like super high. And cooking the things helps as well.
Gotcha. Yeah, I think I heard that too. So, alrighty, see if we got any comments here. Yeah, we got one comment so far from Roger Jamet-Q7Z asks, do you have to take the most mushrooms daily, or can you skip a day or two?
Yeah, Roger, we were just discussing that. So it's fine to take a day or two off. It's the long game that's important. So if you were skipping every other day, like one day on, one day off, that might be fine. But if it's once a week, that's not going to be as ideal. So I think that daily's best because we can build habits in. You could treat yourself to have the weekend off if you wanted to, have a couple of days where you were free of the burden of taking supplements. And I have patients in clinic where they like that. So, but like we've been saying, it's the long-term intake over the course of your life that plays a really significant role in your long-term health, because all of us are interested in our health span. Like, let's be healthy for as long as we can, and then if we live longer, that's great. But who wants to live longer and be burdened with all of the modern challenges like of old age? So mushrooms are a really missing link in the extension of that health span. So my idea, and it's yet to play out, but at 65, it's not that far off, and I can't pretend I'm immortal. I'm going to live forever. Maybe I've got 35 years at the most if I live to 100. So it'd be nice to be perfectly healthy right to the very end, and then say goodbye to all your loved ones one night, and then die in your sleep. So engaging in all of these healthy behaviors, doing all of the having good quality sleep, eating well, having good mental hygiene, thinking good thoughts and not letting your brain spiral out of control, all that, because these all play a really important role, and mushrooms slot right in there as a behavior that's going to help us throughout the course of our life.
Yep, nailed it. Yeah, it's kind of like we want to obviously extend health span and that quality, but in a sense sort of die young, so to speak, to be healthy and just kind of live the natural life of the human, and then just kind of move on. But yeah, that was really good. Alrighty, got another question here from Organic Apple. Can I increase my dose of 5 Defenders to 3 to 4 capsules a day since winter and cold season is coming? If so, for how long?
Organic Angie, that's a great question, and I've investigated that myself. And 3 to 4 capsules a day of 5 Defenders gives you clearly significantly more support from all of those mushrooms, and it allows you to get access to a more helpful dose of each of the mushrooms. And you could do 3 to 4 capsules all the way through winter without any problem at all in my experience. And then once you see the warmer weather coming and you're feeling like you can relax a little bit, then you could reduce that dose. And you could even do 3 or 4 capsules long term. It's pitched at that level, and I'm doing the equivalent of about 5 Defenders a day, and I've been doing that for 4 years. These things are quite safe. It's the hip pocket nerve that suffers when you start to increase the dose. So it's a matter of getting the balance between the effectiveness of the mushroom and spending the least amount of money. So 3 to 4 is fine all through winter, and then you could reduce the dose back to 2 a day once it gets to a more reasonable temperature.
Right on. Nice. Alrighty, go back to the questions here. How might medicinal mushrooms support breast cancer recovery and improve quality of life post-treatment?
Yeah, well, this is an area where there's a lot of interest and a lot of attention. So we can't treat breast cancer per se, but we can support the the health of the patient that is like dealing with that challenge. So mushrooms play a really important role in general vitality and restoration of disrupted microbiota and disrupted immune function. So when women need support, as a result of this, mushrooms play a really important role in that convalescent, like recovery phase.
Mhm.
And the 5 defenders would make, would be a good choice. You could also, maybe add a little bit more turkey tail into that situation as well. The experience of, the treatment for that is really quite harsh on the body, and there's a lot of evidence to suggest, quite conclusive evidence, that mushrooms play a really important role in allowing the immune system to restore itself and to come back to optimal function.
Nice.
It's
Awesome, man.
it's a tricky topic, to discuss
Yeah.
in public with the restraints that are on us, but
Yeah,
the evidence is really good, and I see it in clinic with patients, and
Yeah.
Reishi has got a good amount of research, particularly on the improvement of quality of life post treatment. So
Yeah.
Reishi is a great choice. Turkey tail is a great choice, but 5 defenders, maybe at that higher dose that we were just talking about with the last question, 4 capsules a day would make sense as well.
Nice. Awesome. All righty. Going back, another question here, kind of towards centered on menopause, but how does ergothioneine intake affect women during menopause, particularly in terms of bone and cardiovascular health?
The research is not quite there with bone health. So we know that many mushrooms support bone health during menopause. The ones that have probably got the best results in animal studies are maitake and shiitake, and both of those mushrooms are in the 5 defenders. So you could take those. How much ergothioneine plays a role, we don't know. It very might well play an important role. But we do know about cardiovascular health. And there was a big study done that was published relatively recently, just a few years ago. And they were looking at, I'm a bit hazy on the size of the population now. It was like 20,000 people. And they were followed for, I think, about 18 years. And the researchers were looking at the health conscious diet patterns and the relationship between cardiovascular disease and cardiovascular mortality. And they took blood samples at the beginning, and they took blood samples at the end, and then they looked at the metabolomics. So they investigated the blood for all of the chemistry that was there, and then they looked at, and they used the same metrics at the end. And what emerged as the highest association for a health conscious dietary pattern was ergothioneine, and then next was a compound that was found in citrus fruits, so either lemons or oranges, and the association was such that ergothioneine was very highly significantly associated with improved cardiovascular health and reduced cardiovascular mortality. So that doesn't mean there's causation. It means that there's just an association. But understanding and knowing how ergothioneine works and how it protects cells against stress and how it improves mitochondrial function and may improve mitochondrial dysfunction, it makes a huge amount of kind of common sense that ergothioneine taken throughout the lifespan would improve cardiovascular health. And
Mhm.
in the research world, there's a very significant and troubling inequity between the research subjects in clinical trials. So many clinical trials are conducted on men and not on women. So sometimes it takes quite a long time to find more very highly specific data about women particularly. So in the cardiovascular health area, there's a significant focus on atherosclerosis and the development of that in large arteries in the heart. But the research is now pretty compelling that women and men express cardiovascular health differently as they age, and the risks that women face in terms of cardiovascular health are more microcirculation focused rather than large vessel focused. So in terms of looking after the cardiovascular system, so that's the arteries and the heart and the veins, etc. The research on ergothioneine specifically, around women is we're not quite there yet, but certainly plays a role. But ergothioneine combined with reishi, in my kind of understanding of how the mushrooms work, makes the most sense. Reishi's got the triterpenes, which are they're almost plant-like molecules, which and they're very bitter. They get taken up into the cardiovascular system, into the blood, and those molecules being bitter mean that they've got a particular chemistry that allows them to interact with certain machinery, like in the human body. And there's a lot of animal data to show that reishi triterpenes get taken up in the linings of the arteries and the linings of the small vessels, and they help support and manage stress in those locations. So when reishi is taken long term, it significantly supports cardiovascular health. And these molecules are bitter, and when we taste bitterness, it's all about what's happening in our mouth and our tongue, mostly on our tongue, but in other tissues in the mouth. But the recent discovery around these bitterness kind of tasting receptors is that they're expressed ubiquitously throughout the body internally. So our body's got this ability to, technically taste the chemistry of these bitter molecules, and they play very important roles in how our tissues maintain their health throughout our lifespan. And the human body's got 25 of these bitter receptors, and 21 of them get expressed in the heart and the arteries. And there's no research at all that has looked into this. So the fact that reishi's got this very long history, traditional use around predominantly supporting cardiovascular health, and the use of reishi was never just take it for a couple of months and stop, which is how clinical trials are done. It was taken, throughout the course of your life, like many, many years, decades after decade. It's my contention that the bitterness of the reishi is interacting with those bitter receptors in heart tissue and vascular tissue to support health, in those tissues throughout the lifespan. So ergothioneine combined with reishi make a lot of sense. There's other kind of more scientific and arcane things that I could talk about, but those headlines, I think, make the most difference. So for a woman during menopause, that's when they're like, I've got to do something because this is uncomfortable. But my advice for the younger women listening, to this, Facebook Live would be, get started a decade before, so that when you arrive at menopause, you've done the housekeeping and your body is better poised to manage that change. And if you haven't done that preparation, then there's a need for maybe additional support outside of just the mushrooms, where you might need some very highly specific herbs to support that. Things like black cohosh, in my experience, work really well.
Yep.
And epimedium is a Chinese herb which is great for bone health, and wild yam is a really good herb. There's red clover, for example.
Yeah. Nice. Awesome. Yeah, kind of on that note, this is kind of a question that you kind of just touched on, but looking beyond mushrooms, what herbs would you consider for women's health and vitality in their 40s and 50s?
Well, it can get a bit kind of repetitive. Hey, we just keep on saying the same thing. Definitely 5 Defenders is formulated, for that general, like overall health category, like in that age group. We haven't talked about cordyceps though, and cordyceps has got the ability to improve vitality. It helps to improve the production of ATP energy. And I think it's a great option, for a woman that's looking to, support their vitality. And every mushroom has got immunological potential, and cordyceps kind of often gets forgotten about in that area as well. But there's 3 clinical trials that I can think of where cordyceps has been shown to be very profoundly interacting with the immune system in humans at relatively low doses. So like 1.5 grams of cordyceps militaris a day is enough to make very measurable improvements in the cell numbers and the cell behaviors in our immune system. So adding cordyceps into the mix improves vitality. There's possibly some hormonal benefits that you get with cordyceps as well, but you also get the immune benefits that come along with the other mushrooms. So 5 Defenders, lion's mane, and cordyceps in this 40 to 50 category, would make the most sense. And in terms of lion's mane, I'd recommend 2 to 3 grams a day in that age bracket. And with cordyceps, maybe 2 grams a day is enough. And then in terms of the 5 Defenders, I'd like 2 capsules a day, is a good dose. But if you wanted a bit more oomph, you could do 3 or 4.
Yeah.
Nice. So in terms of herbs, the ones that I just mentioned, and 40s and 50s is, like that's that period of transition. So, the number of herbs kind of gets expanded. Schizandra is great because it helps, deal with, the natural removal of estrogens from the body. So that's always a good herb to go with. White peony, Paeonia lactiflora is the common name. That's a great overall herb for reproductive health in women of all ages. Plays an important role there. The rhodiola, I think, in terms of vitality, is an important one. And real mushrooms, clarity, or is it? Yeah, I think it's clarity's got the rhodiola in it. So, that's a good choice for vitality, and it partners really well with the cordyceps. But
yeah,
the list of herbs is really long.
Yeah. Nice. Awesome. Here, we'll go back to some of the comments here. So Stephanie says, I take 1 capsule of reishi and turkey tail per day for inflammation. Is there any additional recommendation for inflammation?
Stephanie, it depends on what sort of inflammation support that you're after. 1 reishi and 1 turkey tail a day is a really good dose of those 2 mushrooms. those extracts are quite strong, and I think that's a good place to pitch it. There would be room for improvement in the dose there. You could increase your reishi and turkey tail to 2 capsules a day to support that inflammation. But inflammation's a really big category, so you might have some aches and pains in your joints, for example, and then boswellia, would be a really good choice. You might have, more generalized like inflammation, and then something like highly bioavailable curcumin, might play, like a role, broadly speaking. And the list of natural, supplements that would help is like very, very big. If you wanted to do more mushrooms, you could do some 5 defenders to get the benefit of those other mushrooms. That might help as well. But if you want to be more specific, you could type in more detail so that we could guide you more accurately.
Right on. Looks like we got time for probably one more question here. Let's see here. So this next question is why do women tend to experience more autoimmune conditions compared to men?
Oh, well, that's a doozy of a question, and I think I've been working with autoimmune conditions for a long time. I've been lecturing on it for more than 20 years, and it's a really challenging area. And I think when you look at the stats, women are 80% of autoimmune cases, men are 20%. And the earlier that a woman gets an autoimmune disease, the more likely it is that she would get another one. So there's not just one condition, but there's multiple autoimmune diseases that mount up. And I think the best theory that explains this is to do with the fact that women have got 2 X chromosomes and men have got 1 X and 1 Y chromosome. So, Matt, if you need me to simplify things, just come back at me, as I'm explaining it. But in a woman, the one of those X chromosomes is chosen to be the one that's doing all of the work, and the other one gets turned off. So it's only one of those chromosomes that's kind of active in all of the cells in the body. And the way that chromosome gets turned off is by the body coating it with RNA, which is a type of nuclear material that can bind into the various spots on the chromosome, and it neutralizes the way that it works. So an autoimmune disease is just like an inappropriate immune reaction against self-tissue. So, T cells or B cells, if they're educated to attack a particular protein, they will do that, whether it's a human protein, or a pathogenic protein. So, in a situation where cells are being damaged, let's say, then you've got leakage of that cellular material into the surrounding environment, and the immune system needs to remove that debris that's being released from that dead cell. So when the immune system goes to get rid of the nuclear material, bits and pieces of that RNA are being reacted against by the immune system, and the immune system is looking at a piece of RNA that was bound to that X chromosome, and if that bit of RNA matches up with the myelin protein, one of the proteins on the myelin sheath, then that might take you down the path of multiple sclerosis. Or if it's on the skin, it might be lichen planus, which women might get in their mouth. I think that's currently, in my opinion, the best kind of theory to understand, why women experience it more than men. So it's just the basic, difference in the biology. It's not to do with menstrual cycles. It's not to do with, different hormonal levels with estrogen, etc. It's a bit more mechanical.
Yeah.
Did that make sense?
Yeah, it makes sense. Definitely kind of a lot to digest, but it's fascinating to hear your thoughts on it, because you don't really hear a whole lot about it, reading studies and stuff. And I've just always observed it and always kind of wondered why that is. So that was really good.
And the best way for a woman to defend herself against the chances of that is to always be optimally healthy. Deal with things when they happen. So, very often these types of issues occur as a result of infection. So, whether it's a virus or a bacteria, and always being optimally healthy. And I think that mushrooms throughout the lifespan, and there isn't the evidence yet, this is just my opinion, and my clinical hunch is that there would be less autoimmune challenges when mushrooms were taken throughout the lifespan.
Right on. Sweet. Well, that's all the time we got. Any closing remarks or words of wisdom before we send them off?
Well, my typical words of wisdom, at the end of a Facebook Live is to just say, stick with the mushrooms, and don't see it as a fad. It's a lifestyle, and the longer we stay with the mushrooms, the healthier we're going to be. And we could add Ergo Plus into that category as well. So a little bit of Ergo Plus every day.
Ergo Plus. There we have it. Nice. Awesome. Well, thanks, guys. That was great. And
Thanks,
we'll see you next month. So
yeah,
thanks, guys.
Thanks, everyone. See you next time.
All right.
Bye-bye.
Bye.